Hi, my name's Dr. Michael Watts. So I'm a medical doctor turned clinical entrepreneur and innovator. I'm also the co-founder and managing director of Blum Health Limited, which is a software development company breaking down the barriers for clinical innovation. We started out as a trio founding startup that was really feeling the struggle of getting a product from idea to reality. We were hitting all kinds of barriers: procurement, funding, team and resource. So we actually turned our focus to actually breaking down those barriers and built immediate needs. So we actually built a few COVID solutions, and by doing that we internalized all of our resource into our development team. And now what we do is we help other people through collaboration and flexible working arrangements to actually build software solutions for them, actually being able to then take them from that idea to reality whilst innovating on our own as well. So I've known Giant for a few years actually. I've been attending the conferences for a few years now, and it's great to be back out firstly. You know, it's nice to be here in person, being able to meet some of the great organisations both in the Northwest and beyond. I found that the structure of the conference really refreshing, you know, to be able to have that hybridity whereby I've been pitching online, but actually I've been able to network in person, been able to hear some guest speakers in person. I think that Giant obviously moulding to the needs of us as entrepreneurs, but also those delegates that also want to hear about what we're up to, has been really great, and it's been a fun day. One of our bigger innovations where we're actually trying to take the patient through a digital experience through endoscopy and bowel preparation. So it's quite a niche area, but it's one that we found quite early on there's a real need for. So we're going to digitalise the entire patient journey when it comes to requesting a endoscopy report, test, and actually taking them through that process, nurturing them, ensuring that they're well informed at all points in time, and actually making the process from a staffing perspective and from an NHS trust perspective more efficient. So that's going to change the way that patient goes through that journey, and it's quite it's not a journey that many patients enjoy. So we're going to try and make that as efficient, as safe and as informed as possible. The main thing for me is check out the website. You know, if you've got an idea, we're always open to hearing it. You know, if you've got a tried and tested concept, then we can explore that with you further. You know, we're always here to have that discussion, have a 15-minute chat about your idea, and if we think it's worth taking forward, we'll support you in doing that. And even if you know, there's other things that you require, you know, you just want to understand what it's like to go through that startup experience, the barriers that we faced, how we overcame them, and I'm more than happy to have that conversation as well. So please feel free to link in with me, visit our website, and I'll be happy to have a chat.